here with one of my patients, Walter, who decided to undergo partial knee replacement, first on one side and then on the other side. One about 9 months ago, one about 6 months ago. And I often have discussions with patients about who's a good candidate for a partial knee replacement, who's a good candidate for full knee replacement, and sometimes it's just helpful to hear it from a patient of what their experience is like with partial. So the first question I'll ask you is, who was your surgeon?
Dr. Brigati.
And then what was your experience like with him?
Very good.
Okay. And then where did you first hear about partial knee replacement?
I guess from Dr. Brigati, and then I looked it up online and did some study on it to see what it meant. I looked at when it was first started and how the reaction was, and then I tried to find more up-to-date information on it, which gave me a clearer picture of what was going on with it and the success of it. So that helped me make my decision.
Yeah. And then why'd you choose to have partial instead of a full knee replacement, knowing that you were a candidate for either one?
Well, first of all, the length of recovery, the discomfort that may be involved. Of course, I took into consideration my age. I considered my physical activity. I looked at how long the knee would last, as opposed to a full knee replacement. And when you consider that along with the age, you think, well, why go through all the pain for something that may be 10 years longer that you'll never take advantage of?
Yeah.
So it's just it was pretty simple for me.
Nice.
But once I got to that, got all the information I needed. But you need to get the information.
Oh yeah, for sure.
And of course, when I came in here to discuss it, I was a candidate for both.
Of course, yeah.
And you answered all my questions about what to expect and how to expect it. My recovery after I got through was somewhere between 3 and 4 weeks.
Isn't that nice?
As opposed to 6 or 8 with a full knee replacement. And I've been very pleased with it because I'm able to do everything I always have wanted to do and have done in the past. I'm even down to the point where I can get out on my hands and knees as long as I wear knee pads and get underneath things and work on things. I live on a farm, so I'm always down doing something, repairing equipment, and it's made, just made my life a lot more, back to normal.
Yeah. And then how long were you in the hospital for each of these?
Well, I had surgery on the 3rd and got out on the 5th.
Okay.
If I remember right, my last one. So it was a little over a day.
Yeah.
Probably a day and a half. Got up and started walking the afternoon of the surgery and did well on both cases, with both knees. So.
And then, did you have to do any formal physical therapy after surgery? Like working with a physical therapist afterwards?
I believe I did, yeah. I work with a physical therapist.
Do you remember how long you think you did it?
Probably about 2 or 3 weeks.
And then, how long were you on the pain medications after surgery, like the narcotic ones?
Well, I didn't use any narcotic ones on the first one. The second one, I did use a little bit because I was having a little bit longer period of time in trying to recover. And I found out that's kind of a deal where your brain tells you, hey, I've been through this before.
Last thing I'll ask you about is, there's 2 ways to do a partial knee replacement. You can do it manually with just kind of saws and your hands, and you can do it with robotic assistance. We kind of talked about this during your surgery, that I choose to do these with robotic assistance, mostly because it's a technical challenge to, in the shin bone, cut a wedge out of the shin bone with a saw and a saw without undercutting or overcutting, which causes problems. And it's kind of hard to burr this perfect shape in the end of the thigh bone with your manual hand. It's just difficult to do. And so we decided to use robotic assistance. Did you end up looking up any information before surgery on the Mako robot or robotic assistance?
I did.
What'd you think of what they had to say?
I thought that was the way to go.
Yeah,
I mean, it just takes all the guesswork out of it.
Yeah.
Once the robot is set up on you, it just does its thing and according to what it's been told to do.
Yeah.
And the rest of it is up to the surgeon to put all the parts together.
In my opinion, the nicest thing about partial knee replacement is, number one, you get to keep all your ligaments. We don't have to take out any ligaments of the knee. The only thing we take out is the meniscus, the shock absorber between the thigh bone and the shin bone, and we basically just resurface a portion of the end of the thigh bone and the top of the shin bone, pretty much just fixing the arthritic wear that's been lost, the cartilage that's been lost, and nothing more. And you don't have to dislocate the shin bone out from under the thigh bone like you have to do with full knee replacement so that you can get the plate on the top. It's a much less traumatic injury to the soft tissues of the knee, and I think that's what makes the recovery easier. And so thanks for your time, I appreciate it. People have a lot of trouble thinking about what they want to do between partial knee replacement and full knee replacement, and